Hi, my name is John Thomas. I'm a physical therapist at Laguna Orthopedic Rehabilitation, and today I want to talk about treating the shoulder. I want to discuss specifically shoulder impingement syndrome. Many times I'll have swimmers that I treat that come in with reports of pain in their shoulder. Now the location may be anterior or lateral. And what I commonly see with the swimmer is muscle strength and flexibility imbalances. You do a lot of swimming, you're really using a lot of your pecs and your lats, and you'll see the swimmer's posture, they're very rounded. You'll see this V in the back, and what happens over time, you develop this imbalance which then can lead to dysfunction or stress on the shoulder resulting in pain. I want to show you a couple exercises to do to prevent these injuries from occurring, to address these imbalances that might occur if you're doing a lot of swimming, if you're participating in triathlons, and just keep you more conditioned, injury-free, and even you may pick up a little bit of power in your swimming stroke. The first one I want to demonstrate is a pec stretch. Like I said, there's a lot of activity going on with the pecs, and if they become tight, that can lead to a rounded posture. If the shoulders are rounded, you're trying to reach up into the cupboard. This can cause poor biomechanics, which can put strain on the shoulder. If you're too tight and then you're swimming and you're not rotating from your trunk, this can also lead to impingement in the shoulder. So a way to stretch the pecs, you can go to a doorway. You can do two at the same time or just one. The elbow is about shoulder height, 90 degrees at the elbow. And then you're just leaning forward so you feel a nice pulling right across the front of your chest. You hold that for about 30 to 60 seconds. You can repeat that about 3 times. A strengthening exercise, just because you want to have a nice balance of strength front and back, is an exercise I like to do with the band to strengthen the rotator cuff muscles. Again, you have the elbow at 90 degrees, some tension in the band. You're squeezing your shoulder blades together, keeping that engaged while you're externally rotating. And you can do this for about 20 to 25 repetitions. These muscles are small, but they're more endurance type muscles, so you want to focus on higher repetitions and not worry about a strong load. Another stretch, besides the pec stretch I want to do, is a stretch for the capsule. Posterior capsule can often be tight. To address this, you're going to lie on your side. This is called the sleeper stretch. If you can, you want to have your elbow in line with your shoulder, 90 degrees. You're grabbing the top and you're gently pushing down until you feel the stretch in the back. What you can do at times, you try to push it down and you'll notice your shoulder starts to come up. You can just put your chin on that shoulder, push it down until you feel that stretch, and again holding for 30 to 60 seconds. Repeat both sides about 3 repetitions. 3 last strengthening exercises that I want to demonstrate can be performed on the Swiss ball. They're called the Ys, the Ts, and the Is. These are used to strengthen your lower and mid trapezium and also strengthen your lats, so then you can have a little more power with your pull through. I'll demonstrate it in the order: Ys, Ts, Is. The Ys, you're squeezing your shoulder blades together and you're coming into a Y. The T, same thing, shoulder blades together, thumbs up. The last one is a Y, shoulder blades together. With these exercises, as your strength improves, you can add dumbbells, and if you can get 3 sets of 20 repetitions and progress with your weights, that'll help strengthen those muscles and prevent shoulder impingement syndrome. Also, if you do have pain, I definitely recommend seeing a physical therapist in your area, because they can perform manual therapy to address any soft tissue or joint mobility deficits and progress you with more exercises than the ones I showed you. Thanks.